Hey, it's Scott. And I'm here this morning in Miami with Wendy, who is an epidemiologist from the Florida Poison Control Centers. And what we're going to go ahead and touch on this morning is twofold. The first of which is all things that people are freaky about when it comes to fentanyl. And as such, leading into Narcan, otherwise known as naloxone, for everyone.
So, in terms of the epidemiology of who dies from poisoning, there's really no comparison. We're looking at a lot of medications and drugs, and of medications and drugs, about 70% of those deaths are associated with opioids, right? And lately, in our community and around the country, the opioids that are causing the most deaths really are fentanyl. And when I say fentanyl, I don't mean the medical type that you're using, in very controlled circumstances with a lot of medical expertise to treat pain in your patients. We're talking about the counterfeit pills, the illicit fentanyl that is really flooded our drug market over the last few years. So that's been a concern for us in the poison center world, where we're out there trying to save lives from poisoning, moving outside of our child safety sort of comfort zone, if you will, and really trying to identify people at the highest risk and get them this amazing resource, which is naloxone.
Then that, just with that in mind, the whole idea that people are essentially freaked out about fentanyl.
Yep.
On the hospital side and on the EMS side, et cetera, that's really a big deal because we've actually heard of family members or even patients who are terrified because or a provider's going to give them fentanyl.
Yeah.
Because if you crack your femur in 3 places,
You're
fentanyl begins with F, and it's fabulous. It is an absolutely wonderful drug.
No.
As long as you push it slowly, it doesn't, for the most part, drop your blood pressure. Like anything, you push the right amount. It is a godsend when it comes to taking care of pain. But if they hear fentanyl, both family members and the patients have heard all the negative stuff, and it makes it a little bit more challenging. The difference, of course, is when you're not medically receiving fentanyl. That's, again, a completely different story, and that's where this really comes into play.
Absolutely. So I do think some of the sort of substance use prevention, drug safety messaging has gone a little awry there. So we've had billboards locally that says fentanyl kills in huge letters, and again, not distinguishing between the medical version and the street fentanyl or the illicit fentanyl. So locally, we've been seeing deaths, from fentanyl and fentanyl analogs, really leading, in terms of what's killing people from opioids. And so the concern has been not only people seeking, opioids. We don't really have heroin around anymore. Fentanyl has pretty much taken over. But we're also seeing fentanyl turning up in places people don't expect it at all. So, for instance, in counterfeit Xanax would be one that we've seen it quite a bit. Or people who are seeking prescription medications that are opioids, but they're expecting oxycodone, and instead it is fentanyl in there. So, really widely variable dosage, overdoses happening very easily. We see young people, new to drug use, basically just somebody hands them a pill at a party, and really scary situation. So we've been working really hard to make sure that people have access to naloxone. We were very excited to get naloxone in our public school system locally, so that we now have each high school campus has naloxone on campus. So if a student goes down, that staff can respond. While we get rescue on the way, we can buy them some time, essentially. So I have it here.
With that, we were kind of talking about this in one of the previous breaks, but it was an interesting idea, just like almost using a crystal ball and looking into the future.
Yes.
Whereas in many public settings, whether it's a school, event, stadium, whatever, you see the AED strapped to the wall.
Yes.
And in recent years, you see the Stop the Bleed kit with tourniquets and gauze strapped on top of the AED. And whether in the near future, whether you're going to see literally naloxone or Narcan making the top of the pyramid with that on top may not be something so far-fetched when it comes to the future.
Well, and I say in public health, we don't just do one thing. There's not one solution to any health crisis, right? So we say do all the things, right? So do we want to prevent drug use? Do we want to educate about not starting? Sure, we want to get out there and do that. And drug use in kids in general is down. But we also want to be prepared that if somebody does go down. So in public health, we talk about primary prevention. That's the prevention, like don't use drugs at all. Okay, that's great. But we also have tools for secondary prevention, which is someone has done the thing, how do we keep them alive? And that's where this really comes in. So it's now available over the counter, which people have been pushing for a long time. We're glad to see it more available. It is kind of pricey still. People are complaining that $45 or $50 in an over-the-counter pharmacy is a lot for folks. And so there are organizations that are providing it for free. So the HEROES grants are available for our law enforcement professionals so that they can carry it. And this grant came to us, so the material that we give out, we're able to do that through the South Florida Opioid Alliance. So we're so grateful for it because, I couldn't afford to give it out for free, on our own.
Sure. And the moral story, if you've ever given nasal fentanyl, I'm sorry, that would be bad. But we actually I give nasal fentanyl all the time.
Yeah.
I mean, for pain relief,
Yes.
but it's great. So as we finish this up, just a quick reminder that if you're going to give naloxone, otherwise known as Narcan, it comes in your single-use pack. All you have to do is just rip it open, find their nose, go ahead and place this up their nose, push the button. At that point, they're not breathing and or they're in arrest. For the most part, you can't make them much worse. So especially if you have someone that opiate, meaning the really good painkillers, is potentially the culprit, this is something you're going to see far more of coming in the future.